sometimes we as women think that this is something we just have to deal with, and that's not the case.
Yeah, I think that the thing that I hear as a unifying statement from women that I'm always listening to or listening for is this idea that I started to shift the way I felt about myself, or I started to not feel like myself in my own body at this time between maybe 40 and 50 when my hormones were changing. And they all say it. They just like say it in a little bit of a different way. But they said all of a sudden was not myself. My personality wasn't the same. Mm-hmm. I was super irritable, and my husband was like, "What's going on with you? Why are you a completely different person?" I wasn't able to experience sexual pleasure in the same way that I was before. I was having joint pain all the time, and I was working out before, and now all of a sudden I feel like I can't move in the morning. I mean, you can list 75 symptoms I could probably tell you off the top of my head that all are sort of non-specific and can be related to menopause. Actually, I wrote some of them down for you.
Yep.
Broke them up into categories
because
I wanted you to see how expansive these were, and that if you weren't thinking or about menopause, you may not recognize that this would all be put together. So because you mentioned that physicians are really not trained in menopause, and for the last 20 years we've lost complete ground on the training that physicians have had, and so that's part of the medical establishment's issues. But if you listen to these symptoms, they're so vague, and so you may just push somebody off, especially women, especially women of color, right, that tend to be pushed off because they're like, I feel hot all the time, I'm gaining weight, my weight is redistributing from my hips and thighs to my middle, I can't sleep, I'm more anxious, I'm more depressed, I have pain with sex, my libido is bad, my digestion isn't normal, I have headaches, I have brain fog, my memory isn't working, I think I have ADD right now, I have joint pain, I have frozen shoulder, I'm having heart palpitations, my skin is dry, I'm having hair loss, my body odor is changing, and now I'm peeing all the time.
Oh my gosh, right? All of those.
I mean, I could go on, but that's
keep
just
going on. But these are some of the things that you hear when women come into your office and say, you know, what is going on? And then you say, I can help you.
I like, yeah, you're perimenopausal, or you're in menopause, you know, whatever it is. Some of that is just very validating to people, and they love to share their story. I mean, it's sort of similar to like sharing a pregnancy story or sharing your story about your first period. Like, some of it is just validating. And, you know, I haven't been doing this forever, and I have thought of recently the apologies that I need to offer to patients in my past that I didn't recognize were suffering from hormonal transitions. And that's something I've been like learning to contend with, right? Because like even just validating somebody for the way that they feel, and that this is non-specific, and I get it, and I hear you, really does help make them feel better.
Absolutely. Before we go on with this, I want to, you mentioned perimenopause for the first time. I think it's important to make the distinction of the definition of perimenopause, because that's something that we're hearing a lot more with social media, I think, and then what menopause is. It's a specific definition for menopause, and that is?
The definition of menopause is 12 months without a period, without any manipulation to your uterus. So that means you have to have your uterus, you don't have an IUD, you haven't had an ablation, you're not on birth control pills. So it's a clinical definition and not defined by hormones levels, defined by periods.
And then perimenopause
is the hormonal roller coaster. So I usually say that your ovaries shut down in menopause. They stop producing estrogen, but they don't just close the shop like one day. They sputter, and they're like, we're going to be open sometimes, and then we're going to be closed, but now we're going to be open again this month. And so the perimenopause is the sputtering. It's the erratic estrogen production from erratic ovulation that leads to like a roller coaster of hormones. And that can be a tough experience for some people. So for some women, perimenopause and all the shifts that go along with that are harder. Similar to puberty, right? Like we know and experience like our children's puberty, and we know that their hormones are going to be up and down, and we say, oh my God, they're going through puberty, and we accept that. But we don't have the same language around perimenopause to understand that. And so I think for some women that like haven't had that messaging, that's confusing to them.
Very.
And that's why learning about it can be helpful, because if you even just know that this is something to expect in the same way as you expect your child to be going through hormonal transitions when they're going through puberty, like maybe you'd experience that different. And then for some women, the symptoms with estrogen deficiency postmenopausally can be worse. Everybody experiences menopause and perimenopause differently.
Right, right. But the good news is there are options, and that's what Sharon found when she came to you. Talk about some of the options, because it's not just, I keep wanting to call it hormone replacement therapy, but it's menopause therapy, menopause hormonal therapy.
Yeah, MHT.
MHT.
Menopausal hormone therapy.
Yeah. MHT. Okay, so talk about some of the treatments that are out there. Just name a few.
Well, I guess out there in the public eye, right, people talk about a lot about supplements, and there really isn't a ton of good data on supplements that are super helpful in menopause. I think if your symptoms are mild and you try something and it's helpful, then good. The thing that bothers me sometimes about supplements is that women will spend a really long time trying to get benefit from them and then spend a lot of money on them where they don't, and they're not really effective. And part of that is that the medical establishment probably isn't meeting their needs. And then you're going to go on to think about like non-hormonal treatments. And when we talk about non-hormonal treatments for menopause, it's important to understand that those are really very much geared towards treatment of hot flashes and night sweats. Sometimes, especially with some of the new drugs that have come out, they also can help with sleep. But basically, those are treatments that are really targeting what we call vasomotor symptoms of menopause. And then, so there's a new medication that has an on-label indication for treatment of vasomotor symptoms. And then we've been using lots of medications off-label before this new drug came out to treat hot flashes and night sweats. And then hormonal treatments treat the syndrome of menopause. So like I named vasomotor symptoms here, but all of the however many symptoms I named earlier, 25 or 75, only hormones can really kind of address that whole syndrome.
Gotcha.
Right?
Yeah.
So.
Yeah. But there is help, and that's really important.